Time now for a viewer question and a warning. We want to warn you. This question might sound brutal, but we've gotten versions of this question several times. So we want to try and clear this up. Stephen wrote in and said, at what point do we consider refusing hospital care to people who are presenting with COVID and who have refused a free, effective, safe vaccine? He went on to say, thereby overburdening our hospitals and our frontline medical workers, threatening timely medical response to others, raising health insurance premiums for everyone, and fueling a resurgent pandemic. So, Stephen, we can hear your frustration. And again, no, you're not alone. We also know that that very question might make a lot of you at home really angry, or at least really uncomfortable. So we're putting this on TV and we're exploring this for a few reasons. Among them, again, we have gotten that question a lot. We actually just got one very similar to that during the break, during Pat's piece. And also, as you saw in Pat's piece, doctors at that Bend hospital are having to choose who lives and who dies. So we think it would help for people to understand how doctors and nurses make a choice like that, because actually that is not a new concept. More on that in a second. First things first, at today's press conference, we put Stephen's question to doctors and to state officials, and one doctor replied saying he knows medical professionals who have actually wondered about the same thing. But he agreed with the state epidemiologist who said this.
Yeah, I would like to say, while that is a gut reaction to say that people made a choice not to be vaccinated and should fall lower on the list, we have a framework in place that we've worked on with our healthcare partners to prioritize care during these types of crises and emergencies that ensures that we won't discriminate against people because of the choices they've made, because of intellectual or developmental disabilities or other conditions. While we don't want to limit care to anybody, we know that during some of these critical times, we may have to do so. So we've set out some criteria, worked with hospitals so that they can do so in the fairest way possible, even though each of these decisions is difficult for our healthcare teams, for the families and the patients they're caring for. But it won't come down to making a decision based on the vaccine you chose to get or not get.
Okay, so you heard that at the end. That answer was definitive. Hard no. It will not come down to your vaccination status. And you also heard Dr. Dean Seidlinger from the state there talk about criteria that they use. And as we said, choosing who lives and who dies in a surge capacity situation like this, that's not a new concept. For years, hospitals across Oregon had a state-sanctioned template for these kinds of decisions. It was called the Crisis Care Guidance, and in the event of, say, a major pandemic or a natural disaster like an earthquake, it called for prioritizing care to those who would basically benefit the most, like, kind of boiled down to, healthy people with years left to live. It also called, on the flip side, for deprioritizing those with, among other things, fatal illnesses like cancer, heart failure, and so on. But as of fall 2020, during the pandemic, the state is now revising that plan to make it more equitable for people with, among other things, disabilities, people of color, and other groups. And drawing up a new one, they say, will take time, so we don't have it yet. But it bears repeating because, again, we get questions like Stephen's a lot. At no time has anyone floated the idea of deprioritizing care for people who refused the COVID vaccine or any other vaccine for that matter. And as you heard the state say, moving forward, they have no plans to start doing that.